Hey, I'm Dr. David Haas here at the MaxWell Clinic, and I have a question for you. What is your health for? Have you ever thought about that question? What does your health enable you to do? Your health is more than just avoiding sickness or managing symptoms or getting through the day. Your health is that reservoir that helps you live with intention and purpose and vitality to achieve the things that you want to do in your life, to perform as only you can perform in the world. For decades, most of us have been kind of conditioned to rely on a system of health care that focuses just on diseases and on symptoms, and that doesn't really serve us fully. Our system kind of trains us to wait until something goes wrong, and then we react, and then the system reacts against us. Insurance dictates what care you receive, how much time you get with your doctor, and even the options available to you. But I'm here to tell you that it doesn't have to be that way. You can take control of your health, think bigger, and do things differently. This video is for anyone who knows deep down their health could be better, anyone who feels stuck in the limits of the current system and is ready to wake up to a new way of thinking. Traditional healthcare is reactive. It's built for people who are situations where you need somebody to step in and take care of you despite yourself. Emergency room care is a great example of great use of traditional healthcare, where you're going along with your life just fine, you get in a car accident, and now you're zoomed off to a trauma center, and a whole host of very excellent clinicians with great tools rush towards you and can save the day for that acute problem. That's a problem that's really good for something like insurance. Insurance that you typically use on your home is something you pay for those unexpected, rare things that may happen. That's where insurance is actually very useful. You wouldn't expect your homeowner's insurance to be changing your light bulbs or cleaning the carpet or putting new paint on the outside. That just doesn't work. The insurance system isn't built for that. And unfortunately, in healthcare, we've kind of gotten into a system where for many years, whatever a patient went to the doctor and had done, the doctor would send a bill to the insurance company, and the insurance company would pay the bill. And pretty soon, the patient started asking for more things, and the doctor started doing more things, and more bills kept going to the insurance company. The insurance company said, well, that's fine. We're just going to increase the rates that are happening. And those rates would go up. And the insurance company was more than happy that there was more health care being consumed, because the insurance company made money as a percent of how much money was spent in health care. So the more health care that was done, the higher the insurance rates went. And pretty soon we started bundling more and more things into what was supposed to be a safety net system. And then it became very inefficient as a way to prepay for your health care. You'd pay a large sum of money to these premiums, and those premiums would then get doled out to you in various benefits. But that's not a very efficient system, and what's caused is a lot of excess expense, increased inefficiency, and decreased quality by so many middlemen being inside of healthcare. This causes your visits to be short, just enough time to prescribe a medication or order a test. This causes your care to be fragmented because treating symptoms rather than addressing the underlying cause, because there's no incentive for the insurance companies to make your health care efficient for you. The tools that are available to help you heal and thrive and actually build this health so that you can perform in your life and you can enjoy your life, you can have increased longevity. It's not built for that. It's built for how do we just keep the system moving, usually choosing therapies and driving you to therapies that are overly expensive for the amount of benefit that they get. And it's driven a lot by marketing, and there's a lot of collusion between the pharmaceutical industry and the insurance industry and pharmacy benefit managers, and it's just a corrupt system. And the consequences are that you end up stuck managing symptoms instead of truly recovering, and truly finding and developing and growing and enjoying your MaxWell. And you settle for fine when you should feel vibrant. And worst of all, you start to believe this is just how it has to be. Well, this is just the way it is. And the truth is, your health deserves more than your insurance allows. Your life deserves more. And there is a different way to do things. If you think bigger and rethink about your health as your most important asset, I mean, there's nothing that is actually more valuable in your life. All it takes, I get to see this every day. Patients come having lost their health, and they will do anything to regain it. It's so much more efficient to do whatever possible to protect and develop your health before there's a crisis. So your health isn't just about avoiding disease or, kind of clicking off a clean bill of health. Your health is a foundation for the life you want to live. It enables the energy for you to play with your kids or your grandkids. It gives you the ability to chase your dreams and to live with purpose. It's waking up clear, focused, and ready to take on the day. And to do this for a number of years where you get to become an elder that is giving wisdom that can only be created through the passage of years. Elders are so important in our world, and a healthy elder is one of the most important assets that we have as a nation. If you could feel your absolute best, physically, mentally, and emotionally, what would you do with your life? I think that's a good question, right? Would you travel more? Would you maybe start that business you've been dreaming about? How would you show up for your family? How would you show up for your community? How would you take a stand for things that are true, beautiful, and good? How would you become a bigger part of the solution? Your health is what enables all of this. This is your MaxWell, your optimal state of body, mind, spirit that best helps you pursue your dreams, live into your purpose, and enjoy your journey. Your health is about so much more than just surviving. It's about thriving. Please don't wait for a wake-up call to realize that your health is your most valuable asset. You don't want to be looking back and thinking, I wish I had taken care of myself differently. So how MaxWell Clinic does it differently is that we have in complete freedom to focus on you. We don't work for the insurance companies. We don't work for the government. I detest having a middleman inside of what is a sacred environment. The doctor-patient relationship is one of the most sacred places that should exist. It's where you should have complete safety. You should be known and respected. You should be heard. And we work for you. No middleman. That's just wrong. And we have to change the system as a whole. It's great to have insurance for the catastrophic stuff. That's necessary. But the whole idea of promoting and maintaining disease as a way that we're going to think this is a healthcare system, that's bullshit. That's not a healthcare system. That's a disease treatment and management and perpetuation system. We have to get the insurance companies and the government out of the exam room and bring that back to the sacredness of a doctor-patient relationship. And so by making the very difficult choice of stepping outside the traditional system, I made a stand to say, we're going to provide the care that you deserve. I'm your doctor. Your clinician at MaxWell Clinic is your clinician. And that's it. Beholden only to you. That's the way this should work. That's not insurance. Absolutely bastardizes that process and removes you, makes you subservient to some bean counters that are trying to make a profit as opposed to trying to create health as the main goal. So here what's happening when you step into healthcare that's not limited by insurance. We have time, okay? We make the time, real time, to listen to you, to understand your story, uncover the root causes of your concerns. We have tools available that are amazing and treatments that go way beyond the usual just because the AMA hasn't made a billing code for them yet. Do you know how much of your healthcare is controlled by which codes the AMA decides, the American Medical Association, which like only 12% of doctors in the United States are actually members of? They're the ones who control the numbers that decide what you can even bill to insurance. I mean, it's a messed up system. So if we don't have to abide by that organization's control, their stranglehold on what they say is good medicine, then we can do things like brain mapping. We can do things like neurofeedback, like glycocalyx testing, measuring your microcirculatory system. We have the access to some of those advanced regenerative therapies that exist in the world. We have a complex personalized laboratory testing. If the focus is on creating health, if the focus is on helping you regain, optimize, and sustain your health, not just managing symptoms, everything changes. My tipping point was I went to Vanderbilt, to medical school, love Vanderbilt, went to Mayo Clinic for my residencies, love Mayo Clinic, amazing place. But when I was at Mayo, I had this amazing realization. I went, wait a second, I didn't go to medical school and all this residency and all this training and take on $250,000 of debt to do it, to just diagnose and treat disease. No, I was called into this profession to understand and to deliver what creates health. What creates health? That is my driving passion. And it's why so many people are coming around us that want to join this cause. With clinicians are coming to us wanting to work at MaxWell Clinic because we're bringing the heart back into medicine, and we're bringing the deepest and most advanced science into medicine. And the middlemen that are just interested in, taking a chunk out of your dollar as you go from one acute care episode to another, or turning chronic care into a bunch of acute care episodes. No, it has to stop. It has to stop. And we take a whole person approach. You're not just a diagnosis or a collection of symptoms. You are a whole person. You are sacred. There's nobody like you on the whole planet. You have a unique purpose. Nobody can be you. And for us to have the honor to walk alongside of you, to get you to be the best person you can be, to get you to be the best you can be, that is the most amazing privilege. And we get to see that. And that needs to be the standard in healthcare. This is not something that should be unique. It will change. It will change. We will be part of the change. You will be part of the change. At MaxWell Clinic, we do our very best to meet you where you are and to partner with you to create a plan that helps you achieve what matters most to you. And if we're not doing that, we're in a tight enough relationship where you can speak to us and say, hey, this isn't what I thought I was getting. This isn't what I was looking for. Let's have that conversation. We get to continue to modify and change your plan of care. No insurance company allows that, or it doesn't facilitate that. It doesn't have to be this way. You can choose differently. You don't have to settle. You don't have to accept just feeling okay when you could feel amazing. What about that? You only get a few brief moments in this time space, right? Life is fleeting. Don't miss out on having great days. You don't have to let a broken system dictate your future. When you choose to invest in your health intentionally, yes, invest, not spend. When you are taking your resources and investing them in your health, you are investing them in the most important thing that exists of your life. You're making a choice for your future, for the moments, the dreams, and the people that matter most. be bold enough to ask yourself, what is your health for? Are you willing to invest in it so you can live fully, vibrantly, and intentionally? That's your choice. You get one body, one brain, one life. It's up to you to decide how you care for them. And if you're ready to think differently about healthcare, if you're ready to take back control and step into a life of purpose and vitality, we want to be your partner. We're here for you. Your health is your most powerful resource. Invest in it because you're worth it.